So in the surgical emergency, I came across a patient who presented with a blood loss.
Okay.
He had the rapid pulse, but he was maintaining the blood pressure. Why?
Look, in initial hypovolemic shocks, usually of grade 1, actually what happens is that the veins, the systemic veins of the body have a lot of pooled blood. That blood comes into active circulation due to vasoconstriction. And that's why the patient maintains the blood pressure initially. But the pulse volume will be a bit decreased.
Is it a sole mechanism?
No, it's not the sole mechanism. Look, when there is blood loss, there will be decreased urine production, and in the distal convoluted tubule, there will be actually decreased sodium, which will be sensed by the macular denser cells. And those macular denser cells will trigger the afferent and efferent arterioles, which have the JG cells, the juxtaglomerular apparatus, which will secrete renin, majorly in the afferent arteriole. That renin will go into the blood, it will convert angiotensinogen into angiotensin 1. Angiotensin 1 will be converted into angiotensin 2, which is the most potent vasoconstrictor of the body, and this will increase the blood pressure furthermore. And yet again, it will go into the zona glomerulosa of the adrenal cortex, where aldosterone will be secreted. And aldosterone, well, what can it do?
Aldosterone will be increasing the reabsorption of the sodium and the water, and at the same time, it will increase the excretion of the potassium and the hydrogen. In this way, it will be maintaining the blood volume and the blood pressure.
Yes, very good. And it will be acting on the distal half of the distal convoluted tubules. Its receptors in the cytoplasm of those principal cells. Yet again, at the same time, that alkalosis, that metabolic alkalosis, will maintain the patient in a good conscious way, because acidosis decreases the CNS or depresses the CNS. And yet again, it will go again to the hypothalamus, and from the supraoptic and paraventricular nuclei, it will cause production of ADH, which will be released from the posterior pituitary. And yet again, the further mechanism of ADH.
And the ADH will be reabsorbing the water via
Yes.
the aquaporin.
Yes, via the aquaporins and the V2 receptors. And yes, the other name of ADH is vasopressin, because it also acts on the V1 receptor in the peripheral smooth muscles of the vessel walls, which will cause further vasoconstriction. And the story will not finish here. It will go towards the hypothalamus, and it will cause a release of dipsogen. Dipsogen is a hormone which will increase or trigger the thirst centers, and the patient will consume a lot of water, and further the blood pressure and the blood volume will be increased.
Thank you for resolving the mystery for us.
So,